March is Colon Cancer Awareness Month, and early screening can improve outcomes, which is so important as early onset of colon cancer is becoming more and more prevalent in younger patients. Here now from the Carle Digestive Health Institute and sponsoring our segment is Dr. Jonathan Lucking. First, Dr. Lucking, welcome.
Thank you.
I think let's just establish, what is the colon for? What is the purpose of a colon?
Well, the colon is part of our digestive tract. It's usually at the very end. And basically what it is, it's to absorb water and some nutrients from the ingested food and to help expel the waste and the stuff that's not used.
That's awesome. And now we're talking about risk factors, and what are some of the things that kind of create a problem or a risk for colon cancer in the first place?
Well, there are a lot of things that can be risk factors for colon cancer. Common things that we think of that are concerning to us are things like family history, some genetic causes of colon cancer, things like inflammatory bowel disease such as Crohn's and ulcerative colitis. In addition, there are a lot of lifestyle factors that can contribute to colon cancer, things like processed food, fried foods, red meats, and alcohol and tobacco use. So
as you're digesting food, I'm sure it just makes sense. Like, what you put into your body is impacting the whole system, including the colon.
Correct.
Now, we're talking a little bit today about younger people and colon cancer and those risks. What is causing this rise in these early problems in people at a younger age?
For sure, it's not entirely clear, but there are a lot of things to be thought about it. Colon cancer is the second most common cancer in the country, and it can have up to 120,000 people newly diagnosed a year. It's not clear, but there is definitely an increase in younger patients being diagnosed with it, those before the age of 45. And in fact, recently the age of screening was moved from 50 to 45 to help to account for some of this. But still, a large proportion of colon cancers are being diagnosed in those younger than even that 45-year-old screening age.
So I guess that begs the question, should folks that are younger than 45 consider getting a screening, or are there symptoms they should be looking out for?
So they may or may not qualify for symptoms, for screening, but the symptoms of colon cancer can be very vague and can be hard to diagnose and easy to ignore. Things like changes in your bowel movements, such as new onset diarrhea, constipation, narrow stools, blood in your stool, or difficulty with straining, shortness of breath or fatigue can all be signs or symptoms of colon cancer. If any of these things occur for longer than 6 or 7 days, you should alert a physician to let them know.
And talk to your doctor, and then they can help you make that decision and set up the screening if you need it. Now, I know it's some people think of it as an invasive screening, but let's talk about why it's so important to get that screening.
Yeah, it's very important to get that screening because we can detect and prevent colon cancer if we find polyps. All cancer arise from these growths in the colon called polyps, which are benign initially, and over several years they turn into cancer. And so the idea is, with screening, if we catch these early enough, we can remove them before they're even a problem. And with good screening, we can catch colon cancers at an early stage when they're more treatable.
Now, we're almost out of time, but real quick, just to maybe ease some of the minds out there that are considering maybe this is a procedure they should go after, what does the prep and procedure actually look like for a patient?
So the prep has changed over time. The prep has become much easier. It's a smaller volume now than it used to be, and it's usually about 1 liter of fluid split over 2 different doses. Or 2 liters of fluid split over 2 different doses. And it is done based on when your colonoscopy is. It's fairly well tolerated. The patients will take it. They'll come in the morning of. You don't eat anything from the day before, but you'll come in the morning of. You'll do the colonoscopy. It's usually done with some sedation, so patients are completely comfortable during it. Most patients don't actually remember the procedure itself.
So you get it done, and then you get out, and then I mean, I'm sure that's either peace of mind that there's nothing wrong, and you've given yourself that assurance, or you find something early and you take care of the problem. And so screening truly is important. Well, thank you so much, Dr. Lucking, for being with us here today. And if you want to learn more about the risk factors and symptoms of colon cancer, we're going to connect you with Carle, who we appreciate sponsoring our segment this afternoon, over at our website after today's show.